towards me just so I can assess your posture. Okay, so I see left shoulder is higher than the right. Okay. And I see the left ear is kind of higher. If you want to please move forward towards me. Good. Thank you. And if you want to turn to this side of the room, good. And I see forward head posture. If you want to look on the left, if you want to look on the other side. Good. Okay, and I see the lumbar is a bit flattened. Okay, turn to the other side. Good, and you can just face me. Starting with the stock test. First, I'm going to palpate the eye helium and then look for the PSISs. And then look for S2, the transverse process of S2. And I'm just going to ask my client to lift up his right leg. Come back down. As you can see, the PSIS is kind of stuck, so there is no inferior movement of the PSIS. Okay, if you want to do that one more time, as you can see, the thing is kind of stuck. There is no gap. You can put your leg down. Now you're going to lift up your leg and raise up your hands. So lift up your right leg and lift up your hands as well. So as you can see, the restriction is just stagnant. There is no, it becomes more restricted even with the hands elevated. Okay, you can put your hands back down and put your leg down. Good. Okay, now let's look for the left side. PSIS. S2. Now I'm going to ask you to lift up your left leg. You can see the movement, the inferior movement of the innominate. Okay, back up, back down. Now you're going to lift up your leg and raise up your hand. So lift up your leg. You can see the inferior movement and yeah. So back down. So you can see the innominate moving up and down on the left side. So the right is kind of restricted and stuck. That means there's a dysfunction going on the right side of the body. So CCP assessment, starting from the AO joint. I'm just going to place my hand on the occiput. And then I'll bring the neck into full flexion. And then rotate side to side. You can see there's a little bit of restriction on rotation, however it's greater on the left. There's restriction on both sides, but it's greater on the left. Moving into the CT joint. So there is more weight on the left side than the right. My hands on the upper ribs. Side of ease is the right, side of bond is the left. Now placing my hands on rib between 7 to 10. Side of ease is the right and side of bond is the left. Now coming down to the ASISs. For the ASIS, side of ease is the left, side of bond is the right. I'm just going to ask you to please look for your pubic tubercle for me. Thank you. And I'm just going to place my hands in your lower abdomen. So this is just confirming the side of ease is left and side of bond is right. And that is the assessment for CCP. I ask you to turn on your back so we can do like the sacrum assessment. If you want to turn on your back, please. Hi, so we're just going to be starting with the pelvic floor diaphragm release. So I'm going to be placing my hands between the ischiotubers and the coccyx. First, I'm going to be placing my hands in the sacrum. We have the ischiotubers, and I'm only going to be applying 5% pressure. And just wait and listen as the client inhale and exhale. So what I did find is restricted right pelvic floor during exhalation, but pretty decent when the client inhale. Sacrum rocking assessment. I'm going to be placing my hands on the sacrum, listening to the nominal nutation and counter nutation when the client inhale and exhale. So counter nutation is when the client inhale, and nutation is when the client exhale. So what I did find is restriction with absence on counter nutation when the client inhales. So there is an absence of counter nutation when the client inhales. And feel the temperature of the body compared between left and right, and then also look at the pores. So what I find is the right side of the body is a bit cooler than the left on the thoracolumbar fascia. I just want to go back a little bit. Okay, just like. And then I do find the thoracolumbar fascia to be a bit dense. Compared to the left side, the right is a bit dense. Now we're just going to be feeling for the temperature on the anterior part of his body. So we'll be feeling the temperature. We're also going to be looking at the pores, and we'll be comparing it between right and left. Let me place my hands on the chest. So the left side of the chest is a bit cooler than the right, and you kind of feel like it feels a little bit swollen compared to the right side. Placing my hands on is way between 7 and 10. That's good. That's good. Okay, if I open your stomach a little bit. That's all the findings that we got. The left side of the body is a bit cooler than the right, and then the left side looks a little bit swollen compared to the right side. Strain around the clock for the upper part of the body. I'm just going to be working on the upper ribs. I'm just going to place my hands and let my hands sink into the tissue, and I'll just look for side of ease and side of burn. So I'll go lateral, medial, superior, inferior. So inferior and lateral is the side of ease. I'm just gonna stack the tissues in there, and this is my indirect stack. Coming back into neutral, superior and medial, is my direct stack, and I'm just gonna hold to melt the restricted muscles and tissues, and then I'll come back to neutral position. Strain around the clock for the thoracolumbar fascia. Here we found some restriction when we were doing the temperature assessment. First, I'm just gonna place my hands on the thoracolumbar fascia, and then I'm gonna let my hands sink in, and then I'm just gonna glide superiorly, inferiorly, medial, lateral. I'm just looking for the side of ease and the side of bond. So what I find is the body likes to go superiorly and medially. And I'm just gonna stay there for a little bit. I'm just gonna stack the tissue and stay there. And I'll just wait for the restricted tissue to melt into my hands. This is an indirect stack, and this is the side of ease. So I'll come back to neutral, and then I'll stack the tissue inferiorly and laterally. This is a direct stack, and this is a side of bind. And again, I'm just gonna wait for the tissue to melt into my hand. I'll come back to neutral. So that is my direct and indirect stack for the thoracolumbar fascia restriction release. The pelvic floor diaphragm release. I have my client lie in supine position, and I'm just gonna have you put your hand on your chest, and if you want to please move towards me a little bit. Okay, perfect, that's good. And my bottom hand is just gonna be cradling the sacrum, and my top hand is just gonna be on top of the pubic diaphragm. First, I'm gonna have you flex your knee, good, and then I'll have you rotate. I'll put my hands underneath, perfect, extend. And if you want to please show me the pubic diaphragm again, good, perfect, thank you. Now I'm just gonna stay and relax, let my hands sink into the pelvic diaphragm. And I'm just waiting for the softening of the pelvic diaphragm, and then just go wherever the pelvic diaphragm wants me to go. Now I'm just going to be stacking the pelvic diaphragm superiorly, inferiorly, laterally, and medially. So what I find is the pelvic diaphragm likes to go superiorly and medially towards the right ASIS. I'm just gonna stack the tissue and just stay there and wait for the tissue to melt into my hands. So this is the side of ease, superior and right. And again, I'm only using 5 grams of pressure. I can stay in this position for as long as maybe 10-15 minutes until I feel the pelvic diaphragm release into my hands. And that is the treatment for the pelvic diaphragm release. So I'm going to have you flex your knee again, and then turn, good, and then extend. Moving into the next treatment for global treatment, which is the respiratory diaphragm release, to help unlock the restricted breathing on the left and to ease the lower back pressure. Hopping around rib 7 to 10. And I'm just gonna stack the tissue. So I'm stacking the ribs superiorly, inferiorly, medially, and laterally. And then I'll rotate right and left. So the rib likes to go superiorly and medially, which is the right side. I'm just gonna stay there for a few minutes and wait for my hand to melt into the tissue. And again, this is the side of ease. And then once I feel my hand melting into the tissue, I'm just gonna let my hand sink in even more, and then stack the tissue one more time and wait for it to melt into my hands. And then I come out. And that is the treatment for respiratory diaphragm release. Now we're just moving into the next treatment, which is a global treatment, and it's called the lumbar roll treatment. And for this treatment, I'm going to have my client lie on his side facing me. He's going to be lying on his left hand side facing right, because we're trying to correct the breathing pattern on the right side of his body. However, to modify this treatment for a client, with limited knee and hip flexion, I will place a booster in between the 2 flexed knees of the client. But for my client today, I'm not going to be placing a booster on him. I'm going to be, the only thing I'm going to be doing to modify the treatment is to make sure that I do not go past his fader barrier, like the first fader barrier, when I start doing the treatment. So that is how I will modify the treatment for my client today. So Sai, if I can please have you lie on your side. So you're going to be lying on your left hand side facing me, and I'm going to have you move closer to me a little bit. Thank you. And my upper body hand is just going to be cradling on his upper rib cage, and my lower body hand is just going to be on his greater trochanter. So I have my one hand and my other hand. And then for this treatment, we're just twisting. So I'm just going to twist the hip forward towards me and the rib cage backward away from me. And then I can do it vice versa. So like I said, with this client, I'm not going past the first fader barrier, just because of the chronic lower back pain that he has been having for a while now. And this treatment is used to release the diagonal pelvic twist and to restore the lower back breathing, especially breathing around the lower back. So the lumbar roll corrects the pelvic and thoracic spine, decompress the lower back, and stretches the oblique to immediately improve the spinal mobility and of course ease breathing. So don't forget, when we do this treatment, we have the legs of the client flexed, and the client is lying sideline. And that is the global treatment to correct the lower back using the lumbar row technique. Thank you. Now we're moving into the next treatment, which is a local treatment, and is the thoracolumbar fascial release to help soften the muscles in the lower back, and to, help relieve chronic lower back pain. So first, I'm going to have my client lie on his side. So if you want to please turn towards me. So you're lying on your side, good. And if you can please move backward a little bit, perfect. So I have my client lie on his side. He's lying on his left hand side because we are trying to, release the thoracolumbar fascia on the right hand side. Is it okay if I pull up your shirt a little bit? Good, thank you. Now I'm just gonna be gliding. One of my hand I will place on the greater trochanter, and my other hand is just gonna be a soft fist, and it's just gonna be gliding from the lateral border of the posterior layer towards the spine, and then it's just gonna be a soft fist moving downward to the lateral rib cage all the way down to the ilium. So this treatment I can repeat maybe 3 to 5 times. The next direction I'm going to be doing is towards the midline, and I'm going to be using my second and my third knuckles, just so I can be more specific. And I'm moving from the thorax all the way down to the ilium. And next, I'm just going to follow the anterior border of the iliac crest. So starting from the iliac crest, I'm just going to use my both thumb to move towards rib 12. And that is the treatment for the thoracolumbar fascial release. Hi, we're just moving into the next treatment, which is a focal treatment, and it's called the restricted middle rib treatment. And we're going to be using that to unlock the left rib and relieve the lower back strain and restore the diaphragm breathing. Standing behind my client with access to rib 4 to 8, I'm just going to ask you to put your hands to your front. Yeah, so now I have access to rib 4 to 8. I'm just going to place my one hand on top of the ribs, and my other hand is just going to cup on top of the rib, and I'm going to apply a firm pressure downward towards the table. The pressure is firm and balanced, and I maintain this pressure until I feel a softening, and then I just follow the fascia laterally. Once I follow the fascia laterally, I wait for the softening of the tissue. Once I feel the softening of the tissue between rib 4 to 8, I just gently come off from the tissue, and that is the treatment for restricted medial rib, which is a focal treatment. Now we're just re-evaluating the SI joint using stock test. I'm just gonna palpate and look for the iliac crest, and then I look for the PSISs, starting from the right side. S2, there we go. Now I'm just gonna ask you to lift up your leg, your right leg. Good, back down. Now you can see the inferior movement of the SI joint. Okay, let's lift up your leg and then lift up your hand simultaneously. Good. So you can see the inferior movement. You can put it back down of the SI joint. So we have our PSIS walking, coming to the left side. We have our S2. Now I'm just going to ask you to lift up your leg. You can see the inferior movement of the joint, and then back down. Now you're going to lift up your leg and lift up your hand at the same time. Good, so you can see the inferior movement of the SI joint. You can put your hand back down. Thank you. So that is the reevaluation of the SI joint. You can see that the SI joint can now freely move inferiorly. You can see us, right? When I come in. But you cannot see the camera, right? Mm-hmm. Yeah, take your leg off. Okay. I'm now reevaluating the thoracolumbar fascia. I'm now reevaluating the thoracolumbar fascia. Now I'm checking for the temperature, and it feels warmer on the right side than initial assessment. The tissue also feels softer. Initially the tissue was dense, but now it feels softer on the right, and also it has more fluid mobility. Even the breathing pattern is different, like he's breathing better now. And that is the reassessment for our thoracolumbar fascia. Thank you.